Hello. Today I would like to talk to you about recognizing human trafficking guidelines for healthcare providers. This is a new topic that is required for CE for licensed pharmacists in the state of Texas. As a pharmacist in the state of Texas, you are considered a mandatory reporter. So we're going to discuss a little bit about the factors regarding human trafficking, what to look for, and what some of the drivers are in Texas right now contributing to human trafficking. So this is from the office of Ken Paxton. I just downloaded this quite recently relative to his initiatives to address human trafficking. You could consider human trafficking as modern day slavery, exploitation of women and children and men for forced labor or sex by a third party for profit. So that's an important note. It's not just the sex trade. There is also forced labor involved here. And in fact, there is actually right now a very large international case regarding the cocoa industry, which includes Hershey's, the Hershey's Corporation, because of the child enforced enslaved children that are on cacao plantations. And that the Hershey Corporation in the United States had knowledge of this forced labor. Why is it important to have this talk in Texas? Well, unfortunately, Houston just happens to be probably, widely regarded as the sex trafficking and human trafficking capital of the world right now. And there's a lot of contributory factors relative to that. But you can see that these are very large numbers, 234,000 people. So about 250,000 people that are victims of trafficking at any given time, 80,000 victims of youth and minor sex trafficking in Texas. We established an initiative, the Human Trafficking and Transnational Organized Crime Section in Texas a couple of years ago. And by the Texas legislature, Senate Bill 72, the Office of the Attorney General is the coordinator for the plans to address human trafficking. We have had some success, but quite recently with the Biden administration, the issues of human trafficking have actually become much, much worse, unfortunately. Trafficked minors and unaccompanied minors and other individuals that are used as shields for the cartels, that is now an even larger problem. So you can see we have trained more than 25,000 people in person across the state of Texas on human trafficking, and this is an effort to expand that number, and assisted in numerous prosecutions of human trafficking cases resulting in felony convictions and prison time for those that are perpetrating these crimes. But just be aware that this problem is a growing problem and it has not subsided in any way. So here's Texas. While trafficking occurs everywhere, unfortunately, being in the middle and being a border state and having one of the largest state highway systems, and of course, probably as most of you realize, our highway systems are remote. You can actually be on the highway for quite a long time in the Southwest without seeing one single solitary other person. So it's, it's perfect for transit. So at least 20% of US national trafficking victims travel through Texas at some point. Every type of trafficking that is available is represented in Texas. Human trafficking is particularly relevant to Texas because of the proximity to the border. So you can see why we have issues and challenges that maybe other states do not. This actually is a movie, Be the One, that is an excellent representation of stories regarding human trafficking. And we're just going to watch this movie for just a little bit so that you can get a feel for some of the stories regarding human trafficking.
One educator recognizing the signs and choosing to report them was all it took to save her student from sexual exploitation. One neighbor taking action was all it took to free a young woman who'd been sold into slavery right next door. One bystander choosing not to look away was all it took to rescue a 13-year-old who was tied to a bed, drugged, and sold for sex. One person, one moment, one act that saved a life. You are about to see the stories of these real Texans who chose to be the one in the fight to stop human trafficking in our state.
I'm 22, I was 13 at the time, and so this day, in ways, it still affects me. Before it happened to me, I knew it happened, but I never knew that it would happen to me.
We start tonight with a human trafficking concern right here in Odessa.
An Amarillo man is jailed in Wichita County after a human trafficking operation conducted by law enforcement agencies in West Texas.
It's constantly moving throughout the country, even here in El Paso.
We're not just talking about forced prostitution, but forced labor.
Human trafficking knows no race, knows no gender, knows no ethnicity.
It doesn't matter where you're from, whether you're an adult, whether you're a child.
I'm here to tell you it happens everywhere. It happens in the smallest of towns. It happens in the largest of cities.
It's not a Madisonville thing, but if it can happen here, it can happen anywhere.
Human trafficking is essentially the debasing of humanity. It's just humanity at our worst.
Happening in your backyard, it's right next door to you, and you cannot ignore it. Somebody's life depends on you.
The very first trafficking case that was tried in San Antonio, Texas, involved a 13-year-old child. Human trafficking was not a word that anyone in San Antonio knew, but they learned about it through her testimony.
It actually started like any other day. Like I woke up, a friend called me, can you go with me over here? Something that I do every day, like people I hang around with every day. And I went. We were actually there to buy drugs. I remember walking in, talking, and I asked if I could use the bathroom. I remember using the bathroom, and when I tried getting out, I couldn't. And I tried opening the door, like messing with the lock, and it wouldn't open. It was a weird looking door. Well, it had the lock on the outside. I heard him tell my friend that I had already left. So she ended up leaving. And I remember them coming to the restroom and opening the door. And just right there, I guess it is something snapped in my head what was going on. So I tried to run and like fight and kick, but I was too small. It was too grown men.
It's just that girl. She's that type of kid. Well, what is that exactly? She's somebody's baby. She's somebody's daughter. They're somebody's son. And they matter. All of them matter. And nobody should exploit people at their lowest point.
Human trafficking is modern day slavery. It is the exploitation of men, women, and children by third parties for their own profit or gain.
This is a problem, a social problem, and a crime that needs all of us to play our part.
It's a planned community, so the bottom line is that everybody that came here was suburbia. It was, attractive families. That was the whole idea of the Woodlands. It does tend to be very quiet, relatively boring, and a lot of people call it a bubble. This street, specifically with only the 6 houses, we're usually just sitting out here with the kids playing around. So if there is ever a car that comes in, which is only really 4 families that ever come in or out, we get up and we move. So it's a huge difference when there's multiple cars coming in all the time, like we're constantly getting up and getting down.
For the most part, every person that's coming by, and if there's a strange car, everyone that's sitting out here, we're all sort of, who is that? So I got tired of walking to the window every 30 minutes and taking photos with my iPhone of the cars coming and going. We had gotten our father-in-law a deer cam, and I set it up, and after the first day I came in and I put the memory card in, and I think it was like 42 cars had come in and out of our street. this car is interesting because it was the owners of the house, and they would come once a week to drop off groceries. And that was probably the only car that you would notice again and again. It was amazing to see all of the high-end cars coming in, Porsches to Maseratis to broken down pickup trucks to cars with stickers that their children were on the honor roll at our local school. I did a very simple search. All I did was search for the house. And I came across an ad on Backpage.com. And actually on this page, I typed in rolling mill. And sure enough, it came up, just a simple search of the Woodlands. Even today, you're going to find escorts and all kinds of things. But it was very alarming to see my street name on here with this ad with these women and the services that they were providing. It was quite shocking.
The neighbors started contacting the sheriff's office and started saying, hey, there's something wrong with this house. There's something not right. There's a lot of men going in and out. There's a lot of traffic. There's a lot of traffic after hours, which is very unusual in this neighborhood because this house is located on a cul-de-sac.
I can recall calling my supervisor and telling him, you're not going to believe this. We have a human trafficking case in the Woodlands. One of the realities that we discovered during the investigation is these women being held against the will were being raped daily, over and over again, at this residence.
They'd pull in and then another car would pull in and they'd wait and the one car would back out and it was a constant flow of traffic. It was like a locust. They just kept coming and coming. And then when we knew exactly what was happening in there with these women, it was really disheartening, especially having 2 daughters. Very frightening.
And we realized that these same girls were being transferred not only in Montgomery County, but also to Harris County and being sold in other locations for sex over and over again, from one spot to another spot. And this led to an even larger investigation that we discovered was in New York. And we discovered that these women were being brought in for this purpose from China.
And we have another breaking news alert out of Montgomery County. 4 arrests linked to a human trafficking bust. They discovered 4 different locations the girls were being taken to. Prosecutors say in this case they found 8 victims, women who are Chinese nationals around 20 to 30 years old.
So as you can see from the video, there's many more stories discussing cases relative to human trafficking and how a neighbor or a vigilant community member noticed a pattern of behavior that led to the investigation. And this is what we would like to discuss today. You can see that the San Antonio case, the case in the Woodlands, there's cases in Bel Air, there's cases in Amarillo, in El Paso, in Lubbock, in every small town and large town throughout the state of Texas. This is not an inner city poor neighborhood problem. This is an everybody problem. Trafficking is the practice of exploiting adults and children for use as commodities. That means you're selling their labors or in some other way forcing them into servitude. Tactics that are used by recruiters, traffickers, and their associates are often the same tactics used by batterers and can mirror dynamics of domestic violence. Traffic is not limited to formal work sectors. It can occur wherever there is work. To include construction, lawn care, any kind of manual labor that you can imagine. People are trafficked for many kinds of work and sexual exploitation, debt bondage, sex industry, to include just photographing pornography. Child pornography is actually huge in the greater Houston metropolitan area. Domestic labor, agricultural work, restaurant work, factory labor, anything you can think of. What do traffickers look like? So that's the problem. They look like everybody. There is no one particular look to a trafficker. Traffickers are people who are willing to treat other people like objects or commodities that they can buy, sell, or exploit for their benefit. They can be people of all races, people of both genders, family members, peers, employers, gang and cartel members, strip club owners, managers, or the massage parlor owners, intimate partners, neighbors and friends, online acquaintances, you name it. Traffickers often accompany victims at all times and can be what looks like friends, family, romantic partners, and actual friends and family and romantic partners are not immune from selling those that they claim to care about. Sex industry managers and pimps, U.S. and international government employers, e.g. diplomats, and legitimate employers, such as households with domestic workers. Trafficked persons can meet all these kinds of different groups. They can be, well, just about anybody, really. The elements of human trafficking. Number one, the process: recruiting or harboring or moving or obtaining. So anytime when a person is put into a situation where they're being coerced, you can consider that that's part of the process. The means: by force or by fraud or coercion. For the purposes of involuntary servitude, debt bondage, like coming to, you know, how folks that traffic people across the border, you have to pay off your debt to that person. That's a form of trafficking, debt bondage. It's illegal. Slavery or commercial sex acts. Be aware that minors who are involved in commercial sex acts or pornography do not need to prove force, fraud, or coercion. What are the common myths about human trafficking? Here's a big myth. We live in a slavery-free world. The reality is there are more people enslaved today than there were at the time of the transatlantic African slave trade. There are 25 million people enslaved worldwide, with another 15 million in forced marriages. Myth: trafficking is a crime all about movement, immigration, and 18-wheelers. Reality: smuggling and trafficking are two distinctly different crimes. Smuggling is a crime against the border, where someone enters a country without the appropriate documentation, typically by paying someone else to smuggle them across the border. It requires transport and movement from one country to another, and both the person coming in without permission as well as the person bringing them in are committing a crime. Myth: this doesn't happen in my hometown. Trafficking occurs in cities and towns all across Texas. Common red flags in a healthcare setting. Here's what to look for. There are environmental or situational red flags: suspicious employment situation, or no one wants to answer. So if a person comes into a healthcare setting and they have to have their friend or coworker answer direct questions, that is a red flag. When I worked at Texas Children's Hospital, one of the issues was that when you're questioning what was supposed to be a parent or responsible adult for a minor, they couldn't answer very simple questions about the background of the child. For instance, what is the birth date? What is the child's favorite color? What is the child's favorite food? Couldn't answer those questions. Those are key red flags. What appears to be an abusive relationship, like the person is told to shut up, or it's quite obvious that whoever they're with is in control or trying to control them. Verbal, emotional, and psychological issues. Providing healthcare provider with contradictory information between the accompanying friend or coworker or supposed parent and the child or enslaved person who is providing information. If they appear obviously suicidal or obviously depressed, fearful, anxious, trauma, recoil from being evaluated or during any sort of medical inspection or medical evaluation or medical procedure, like something simple like using a stethoscope to evaluate heart rate or to evaluate breathing. A person that is in this situation will often recoil and be fearful. Untreated injuries, explanations that are inconsistent with injuries. There are certain types of injuries that are definitely quite hallmarky. I'm sure you're aware of, like rotational breaks or cigarette burns, those kinds of things. But if the, constantly, saying that you fell down or you're clumsy, that's another issue. Multiple treatments for STIs or multiple abortions and evidence of sexual abuse, all obvious red flags. Here's some other medical indicators. Delayed medical care. This is quite obviously a severe injury that happened days or even weeks ago, and you're just bringing in this person now for treatment, when typically you would bring in a person for this kind of injury right away. Headaches, fatigue, abdominal pain, back pain, severe untreated dental problems, high blood pressure, obvious malnutrition or malnourishment, and substance use or misuse are all, in combination, another set of common red flags. Trauma indicators include unusual reactions to gynecological or breast exam, appearing fearful, screaming, sobbing, tensing up as if expecting intense pain, hyperventilating, fainting, going limp, all unusual reactions that may indicate a red flag for this type of abuse. Unusual reactions to disrobing, sexualized behavior or seductiveness, particularly in a child, seeking inappropriate proximity to nurse or doctor or other healthcare clinician. Flinching or jerking away from physical contact. Or the opposite, total lack of responsiveness, appearing checked out as if in another place, not responding to verbal prompts, doesn't respond to the given name, or confused and having difficulty paying attention or difficulty following the line of questioning. Special considerations for minors include involvement in commercial sex industry, runaway and homeless youth, and their involvement in abusive relationships with adults. So survivors are victims of trauma, and they have this has a situational impact to medical assessment. The victim will definitely fear consequences and retaliation by a trafficker. This is especially common. Threats are typically made against other family members. Sometimes, kids will have siblings that are both in this situation, and the trafficker will make threats against the sibling. They will make threats about deportation if the person is a foreign national. So social services interventions are key, especially for youth who previously experienced abuse or harassment in foster care placements. So victims are in crisis mode. They will have trouble recounting detailed histories, especially medical details. They may not self-identify as a victim. They tend to have loyalty to traffickers because that's the only support system that they currently have or know. There may be cultural or language barriers. They have a general mistrust. The victims will have a general mistrust of healthcare professionals and may believe that your intervention will hurt them rather than help them. And they may have a very limited understanding about their legal rights, especially if they're foreign nationals or undocumented individuals. Best practices when interviewing a trafficked person: use the same words the patient is using and don't correct them, especially as it refers to their relationships or situation. If they call this person their uncle or their friend, don't correct them and make it seem as though they're wrong about this relationship. Be open to unfamiliar narratives and stories. This may be the only chance that you get to establish rapport with this patient, and you want to make sure that you get as much information as possible. Use your authority as a healthcare professional to create a safe space for talking. Speak with your patient privately. Always use professional interpreter services when a language barrier exists. Do not rely on a friend or an associate if interpretation services are required. You could be dealing with the trafficker then. How do you know that that trafficker is going to accurately translate for this person? It's quite unlikely. Use a trauma-informed, non-judgmental approach when interviewing patients. The last thing we want to do is accuse this person of poor judgment or ask them, why did you do this? Why didn't you do this? You know, you want to make sure that you're creating a safe, non-judgmental space for this person to tell you their story. Traffickers often prevent trafficked persons from receiving regular medical care. However, trafficked persons commonly find themselves in the ER when injury or illness escalates to the point of becoming life-threatening. Ask direct questions such as, are you in a personal or work relationship with a person who physically harms or threatens you? You seem to be in a hurry to leave. We are here to help you. It is important that you remain for treatment. What is making you feel anxious to leave right now? Have you been hurt while working on the job, either by someone you work for or with? Here's other questions you might want to think about asking. Where do you live? Who do you live with? Are you able to come and go as you please, or do you have to be accompanied by someone? Are you free to talk to anyone you want outside of your home or work? Do you know where you are right now? How did you get here? Do you feel safe at home or with the person who came with you today? Has anyone made you do something you didn't want to do? Have you been physically threatened, or has your family been threatened? Have you ever been asked to work in an environment that is unfair, unsafe, or dangerous? If you suspect human trafficking, you can submit an anonymous tip to the National Human Trafficking Hotline. For immediate assistance or to speak directly with a hotline advocate, call 888-373-7888. I am going to repeat that number several times for you throughout the rest of this presentation. Remember, as a licensed healthcare professional in the state of Texas, you are a mandatory reporter. If you think your patient is a victim of human trafficking, communicate messages of hope. You have rights. You are not alone, and this is not your fault. You are not to blame. You are entitled to services and help. Assess safety. Are you afraid to go home? Do you have a safe place to stay? What would happen if you didn't return to your worksite residence this evening? Make referrals. Connect your patient with the hospital social worker or the community social services by calling the phone number that we talked about. Connect your patient directly with an appropriate service provider. If an identified patient is not ready to accept your help, remember, they do not always identify as victims, and they may be fiercely loyal to their traffickers, perceiving that this is the only support system that they have. Validate and normalize their feelings. Reassure them that they have the choice not to accept your help at this time, but you are always available if they change their mind. Provide information. Many trafficked persons will seek assistance for their situation when they feel safe and able to do so. Tell your patient where they can go for help in the future, i.e., return to the clinic or return to the pharmacy. Make sure to communicate options verbally, since traffickers are likely to destroy written instructions if they are found. If you think your patient is a victim, do not try to rescue the patient. That is not your job. You need to connect them to appropriate services and to call the National Trafficking Hotline. Do not ask about the patient's immigration status. That is a surefire way to destroy trust with your patient. Do not contact authorities without the patient's permission unless mandated to do so, which you are as a licensed healthcare professional in the state of Texas. Do not make promises you can't keep. Do not say, like, this is all going to be okay, we're going to do this, we're going to do that. Make sure that you keep your rhetoric extremely professional. Provide the patient with contact information for social services. Here's some tips for medical providers. Here's the risk factors that we discussed. Here's some signs and suggested in human trafficking victimization, and the slide set will be available for you to download. Victim may not self-identify. Victims may deny mistreatment. Victims may defend their trafficker and may have been conditioned to do so. So this is kind of like a cheat sheet for you to recognize signs and symptoms. Here's some safety tips when a patient is suspected or known victim. Safety is the top priority. Treat each situation as extremely dangerous until you have evidence that it is safe. You can notify 911. and attempted to speak with the patient alone. Use your authority as a healthcare professional to get a safe, private space to speak. Do not attempt to speak to the patient if you believe this will threaten safety. Do not allow anyone in the room while speaking with your patient about your concerns, especially those people that you suspect to be exploiting this individual. Do not allow any cellular telephones when you are speaking with your patient. Do not pressure the patient to disclose a report if they do not wish to. It is critically important that students are introduced to training regarding human trafficking. As a preceptor, you have a responsibility to ensure that your students understand human trafficking and to introduce it to them during rotations. Victims are consistently under-recognized by healthcare providers, and education for future practitioners is key to addressing this problem. Preceptors can provide simulation guidance and introduce the topic in a conversation that simulates a situation relative to a human trafficking case, allowing the student to be introduced in a safe environment. I'm aware that this is not a topic that most students have thought about or may be comfortable discussing, but it is important as a preceptor to start introducing these concepts early on. Preceptors can provide information on the statistics and prevalence, as we have talked about in this presentation, of human trafficking to students, ensuring that students have awareness. Preceptors can use a case-based approach to introduce generalized guidelines or signs to look out for and include what to do next. This is key. The National Human Trafficking Hotline, 888-373-7888, should be introduced, or text 233-733 to be connected with an expert in human trafficking services. Make sure that PharmD students are aware that by Texas law, they are required to complete Texas Health and Human Services approved human trafficking CE for licensure renewal, and that pharmacists and pharmacy technicians are considered mandatory reporters. You can discuss the following article from APHA Pharmacy Today, and I have the website that you can use for this particular article. The full text is available on the internet, and it's about what pharmacists see, or worse yet, what they don't see. Simple cases for discussion include this kind of case. Here's a pediatric sex trafficking simulation case that was developed by the University of Louisville. It's quite simple. You can introduce these signs and symptoms for students so that they can recognize what the signs and symptoms are for human trafficking, to include their affect, the patient's affect. You can see the patient's history, and a physical exam that may include cigarette burns and tattoos that may be inappropriate, say for a young child. Here's some highlights of that APHA article, What Pharmacists See. The experiences of trafficking victims illustrate what signs pharmacy staff can observe. One young survivor, whose father had sold her to settle a gambling debt, reported that once a week, the traffickers would take one of them, the girls, into the local CVS to get sanitary napkins, tampons, and anything that the victims might need for healthcare purposes. Then they would take them to the pharmacy and order a box of 1,000 condoms week after week. The girl said, "I always wished that somebody would say something or ask a question or make a report after we left, but nobody blinked an eye." Several survivors reported that their traffickers would buy boxes of Plan B because the customers were not using condoms. After an encounter, the traffickers would force the victims to take Plan B. Pharmacists tell Letterer that they've had suspicious experiences. They would say, "I'm pretty sure I had a case like this," or "I'm pretty sure that I saw this, and here's what it looked like." So we know that pharmacists are confronting this and are seeing it. We just don't have a clear roadmap right now to help them understand how to handle it in the professional context. So in all these cases, what should have been done was calling the national hotline and providing the tip and what you saw. Here's contact information for you. Again, for immediate assistance or speak directly with a hotline advocate, here's that number again, 888-373-7888, or text help or info to 233-733. Offer the patient the National Human Trafficking Research Center and tell them they can text 233-733 if they want help or to talk to someone. Child Protective Services in the state of Texas can be immediately contacted if a child is involved at this number, 1-800-252-5400. Call the Office of the Attorney General in the state of Texas at 512-463-1646, or you can email at humantrafficking@oag.texas.gov. The OAG has law enforcement officers that are specially trained to combat and investigate human trafficking around the state. These are all resources for you to function as a mandatory reporter of suspected human trafficking. Here's more information and resources for you. Again, I've repeated several of these resources. Here's the SOAR program is especially good training. This training equips healthcare professionals to identify and interact with individuals who have experienced trafficking using a victim-centered and trauma-informed approach. I highly recommend it. SOAR stands for Stop, Observe, Ask, and Respond. This is trauma-informed care at its best. For information or training, technical assistance, and resources, email the Texas Human Trafficking Resource Center at humantrafficking@hhsc.state.texas.us. This has been a really important talk. I hope that you feel comfortable providing mandatory care and mandatory reporting for suspected cases of human trafficking. Let's all work together and make sure that Texas does not remain the capital of human trafficking in the United States and in the world. This is something that just one person, one trauma-informed, astute and aware person looking for signs and symptoms of human trafficking can make a difference. Thank you.
We are going to be talking about human trafficking in the healthcare profession. It is a very relevant topic to today's society in the world. In fact, I was just reading an article about a mom who is diligently trying to rescue her daughter who is being trafficked out of Houston. She has not been able to do that. She's been on the hunt for her daughter for, I want to say, about a year or so. She's rescued many other victims in that same human trafficking ring, but unfortunately, she hasn't been able to find her daughter. So again, it is something that is happening right here in our own backyards. It happens here in Corpus as well, not just in Houston and our outlying areas. We have had several human trafficking cases here in Corpus Christi. So today, what are we going to go? Let's go over it in a nutshell. I'm going to define what human trafficking is and how we can identify human trafficking. Human trafficking encompasses a whole lot. So in the 45 minutes I have with you, the 50 minutes I have with you, I'm going to try to get as much information as I possibly can in this short span of time, but I'm just going to be brushing the surface of human trafficking. There's so much more to go into when you dive deep into what human trafficking is. Then we're going to talk about why is that important? Not only why is that important to us as individuals and us as human beings, but why is it important to you as future healthcare professionals? And then we're going to go over just a few scenarios and then what to do when that happens to us, when we are, you possibly have a patient that comes up to your window. So in all of my presentations, I will always give a trigger warning because I don't know who my audience, I don't know who my audience is. I don't know what your stories are, but I do know how prevalent this violence is, whether the violence be domestic violence, human trafficking, sexual violence. I know that it happens every day, every minute, and the likelihood of somebody in the audience having been affected by it or know somebody who's been affected is very high. So please practice self-care. If at any time you need to put your head down or step away because it gets to be too much, too heavy, please practice self-care. I also like to give a disclaimer. I tend to use the pronouns she and her when talking about trafficking survivors and victims, and he and him when talking about traffickers. Now, I do know that there are male survivors out there of human trafficking, of domestic violence, of sexual violence. There are male victims out there, as well as there are female perpetrators and female traffickers. But statistically, we see more female survivors and we see more male perpetrators and male traffickers. So I'm going to try to use just a general pronoun of they when talking about both. But if I tend to sway more towards using she for victims and he for perpetrators, that's why. But again, I'm well aware and acknowledge the male victims that are out there. So now let's go into what human trafficking is. What exactly is it? So human trafficking is defined as the recruitment, harboring, transporting, and obtaining of individuals for commercial, labor, and sexual exploitation. That's really important to know because when most people think human trafficking, they're going to think sexual exploitation. They think sex trafficking, but it's a lot more than just sex trafficking. It's labor trafficking, it's domestic servitude, it's child labor. It's a lot more than just sex trafficking. But in order for it to be considered human trafficking, it has to have force, fraud, and or coercion. Those are the means that the traffickers will use to victimize somebody. Now, what do I mean by force? Force is going to be any kind of physical violence, beating, torturing, raping, branding. Those are all means of force. When I talk about fraud, we are talking about a fraudulent job posting. Somebody posts something on an online job, the one ads, or maybe Craigslist, and somebody applies for that job, gets to the place of the job and finds out the pay is not what they said, the location is not what they said, and it's a pretty shady deal. But now they're there and they're kind of stuck. And that happens a lot with mail order brides, with domestic servitude, with massage parlors. That fraudulent job posting, fraudulent acting happens quite often in those. And when we talk about labor trafficking. Now, when we talk coercion, that's different things as well. The most common one, especially in today's environment, is a lot of times you're going to have somebody who is undocumented. Maybe they have applied for a job, or maybe they have come over with somebody, and now their papers, their documents to be able to get them a job or get them here correctly is being held over their heads. Their trafficker is saying, unless you do this for me, unless you make this amount of money, I'm going to give these papers to the law enforcement officials, and you're going to get deported. Or they may be threatening their family and friends or their kids. Unless you do what I ask you to do, I'm going to take away your kids. So all of that has to be in place somewhere or another in order for it to be considered human trafficking. If force, fraud, and coercion are not part of it, then it's just exploitation, which is another type of crime. However, the only exception to this rule is with minors. Whenever a minor is involved, whether it be sex trafficking, labor trafficking, it is always considered trafficking. Means are not needed. So the trafficker does not need to use force, fraud, or coercion when it comes to minors. The other thing to keep in mind is the money. Money isn't always involved when it comes to trafficking. Yes, human trafficking is a hugely profitable crime. It is a hugely profitable business. But a lot of times what's being traded isn't money, it's something of value. So for example, sometimes a landlord may ask for sexual favors from their tenant in order for them to continue living there. Or a boss may ask for sexual favors from one of their employees in order for them to continue getting paid. Those are forms of trafficking. That is, they're being coerced into performing those acts. Or if it comes to construction working, somebody may be forced to work 13-hour days in order for them to get paid. They may not have a choice if they can only work 6 to 8 hours. So again, money isn't always involved when it comes to trafficking. Now we want to talk about the difference between human trafficking and smuggling. A lot of times these two go hand in hand, and a lot of times somebody may think that somebody being smuggled is actually being trafficked. So we're going to go over the difference in the two. So human trafficking, when you talk about human trafficking, it's typically done against a person's will. That person that's being victimized is not consenting to any of the acts that they are having to be done, whether it be sex, whether it be hard labor, domestic servitude, they're not consenting. It is being done against their will. Also, it doesn't have to travel. A lot of sex trafficking happens in one location. It happens in a house or a hotel room, or if it's labor trafficking, it's happening in one industry, one business operation. So again, it doesn't have to involve me being transported from place to place. And unfortunately, human trafficking of any kind is usually ongoing. It's a lifetime of exploitation and abuse unless that victim is able to be rescued. Now, so that is all what we mean when we talk human trafficking. Now let's go and talk about smuggling so you can know the difference. Typically, smuggling is done voluntarily to somebody. Somebody is going to pay another person to transport them to a certain location, or they're going to pay that person to transport an item to a certain location. We talk, smuggling is often used when it comes to smuggling drugs or smuggling guns. So again, it was done voluntarily, and smuggling is typically going to be transporting somebody across borders, whether it be city borders or state borders or country borders. It's from one place to another. And the smuggling will end once they've reached this agreed upon destination. I pay you this amount of money to transport me from A to B. Once we get to B, that's it. Our transaction is done and you send me on my way. However, many times smuggling, especially if it's smuggling of humans, will turn into trafficking, because now that transporter who transported that person from A to B knows that that person's vulnerable. They're in a new location. They don't know anybody in this area. They probably don't have transportation. They don't have money beyond what was given to them. And now they're super vulnerable, and the transporter is going to take advantage of that. And then again, often transporters are transporting humans and victims and people to their traffickers, to somebody who is looking to traffic those people. So again, there is that difference between trafficking and smuggling. They're not the same. However, smuggling will many times turn into human trafficking. So now we're going to go over to different types of forms of human trafficking. Again, as I mentioned, most people, when we talk human trafficking, they're going to think sex trafficking, and that is definitely a form of it, but there are multiple forms. I've mentioned domestic servitude multiple times. That is when somebody will go work in somebody's home or maybe business as a cleaning person or a maid or even a live-in nanny. Now that person is stuck because they're not getting paid the way they were supposed to be paid. They don't have enough money. If it's a live-in person, somebody went to go live there, they probably let go of their apartment or their house, and now they have no place else to go but where they're supposed to be working, but they're not getting paid enough money to get their own place. Or they were supposed to be a nanny, but now their boss is asking for sexual favors in order to keep their job and keep them staying there. Then, of course, we talk sex trafficking. Now, sex trafficking happens a lot in prostitution rings. Now, not all prostitutes and sex workers are trafficked. There are some sex workers who do that for a living. That is how they make money, put money, and they're doing it consensually. But there is a good majority of them who are being trafficked, and their trafficker is what you would call their pimp. And then, of course, we have the pornography industry. Same with sex workers. Some do it legitimately as a form of income. They do that consensually, but many porn sites do have sex trafficking on there. There is a huge push right now to try to ban one of the sites called Pornhub, because there have been actual tapes of victims of trafficking being raped on camera on Pornhub. But of course, the traffickers don't put it as that, they put it as something else. So again, there's a big push for that. Then we talk about forced labor. Forced labor is construction, it's nail salons, it's working in the farms. All of those are different forms of forced labor. Many times the male victims are going to be in this category, but there are females who are also forced into labor, forced into that type of trafficking, but the majority will be male victims in this category. And a lot of times this is where people talk about the modern day slavery, because these victims that are in this part of human trafficking are forced to do all this tough work in the heat of the day with very, very little payback. They're not getting hardly paid anything. Their living conditions are probably in the, living in the dirt, not having much to eat. And so this is where a lot of people, when they talk about modern day slavery, they're talking about forced labor. Then we have bonded labor. Bonded labor is when somebody did something for you and they say, this is how much I'm going to charge you. For example, the smugglers, it will cost you $500 for me to do this for you. So the act is done, but now all of a sudden that $500 went to $1,000 because they're putting on all these different things. Will I help pay for your food? You need to help me for gas, whatever it may be. So that debt that needs to be repaid never gets repaid. It is a lifetime debt because what they're making is minimal, so they're not able to repay it, and then that debt somehow keeps increasing. Then, of course, we have child labor as part of human trafficking. This is anytime any minor is forced to work. It could be domestic servitude, it could be sex trafficking. We can have minors that are being forced to work in the farm industry or even in the construction industry. Sometimes people talk about sweatshops, where there's a room full of teenagers who are working there in horrible conditions and aren't getting paid anything, but they're being forced to work there. That's where we talk child labor. And then forced marriage. Believe it or not, there are still quite a bit of mail order brides that are being trafficked in. And these ladies who come into the state or travel to where they're going to meet their husband, they're doing it because they're wanting a better life for themselves and their family. They're doing it because they're promised, the American dream if they're coming to the United States. Yet when they get here, now their husband becomes their trafficker because their husband is forcing them to do sexual acts they may not want to do, forcing them into prostitution, forcing them into doing other things. And they're stuck because they came here and now they have no documentation. They have no way of making money. They have no place to live except for with their trafficker. So these are all different forms of human trafficking. The other type of human trafficking that we don't really talk a lot about is also organ trafficking. That's when a lot of times a trafficker will take the organs from a body without that person knowing, or they'll sell it in the black market. But that one doesn't get talked up as much as these other forms of human trafficking. So how can we know what types of human trafficking are there, but how can we identify human trafficking? So there are a number of different signs to look out for. I wanted to focus on these signs because these are going to be the ones that you as pharmacists, as healthcare professionals may see more often. We talk about, frequent trips to purchase birth control. If somebody is going up to your counter and you've seen the same person come 3 or 4 times in the last 6 months, and they're always asking for the morning after pill, or they're asking for emergency contraception, that could be potentially a red flag. Maybe just doing it 1 or 2 times isn't, but multiple times is definitely a red flag. If they also have frequent UTIs or STIs, there's another red flag, especially if you've talked to them before at your counter, about precautionary methods, how they can help prevent that from happening in the future, yet you still see them again and again. If they show up with the same person over and over again, and that same person doesn't let them talk for themselves, you're asking the patient questions, you're asking them for just basic demographic type information or basic information to get more about what's going on. And now that person's with them and they're not being able to say a single word. Or every time they talk, they're looking at the person that they're with to make sure that it's okay for what they're going to say. The accompanied individual also wants to fill out all of the paperwork. So if you have to have them fill out certain paperwork, or they're giving you information like their date of birth, their address, maybe a cell phone number, that some of that basic information, and the patient doesn't know it or isn't allowed to give it out, only the person they're with, that's a red flag. Why doesn't the patient know their date of birth or know their address? Why does somebody else have to put that down for them? If the patient looks like they're malnourished or has bruises and marks of abuse all over them, has bruising around the necks or their wrists, or if they're wearing shorts, you can see bruising on their legs. These are all signs. Now, are these signs definitely indicative of human trafficking? No, they're not. But they should raise up some red flags, some concern to prompt you to want to see, maybe hopefully delve a little bit deeper. Some of the other signs that I didn't put up here are, it's not commonly used as often, but is branding and tattooing. The most common type of tattoo is a dollar sign. We've seen some victims that will have a dollar sign tattooed on their wrist, or a barcode tattooed on their wrist or on the back of their neck. Because unfortunately, to these traffickers, these victims that they're trafficking are property to them. They see these victims, these people, as money signs. And so they're going to try to mark them as such. But when we look at talking about ways to identify, it's really important that we talk about proximity and context, because these two are important when truly identifying if this person is being trafficked. So when I talk about proximity, you want to keep in mind, how often do you interact with this person? Is this the first time you've seen this person? Is this the second or third time you've seen this person? How well do you know this person? I know you only, as a pharmacist, somebody will come up to your window and you may only have a very short amount of time. But within that short amount of time, have you been able to get to know them just a little bit as far as their name and where they work? If it's somebody coming from construction, have you been able to figure out, oh, this person works at ABC Construction? So how well do you know this person and some of the things about their story and what's going on? And if they're with somebody, do you know who that person is? Is that the same person that comes in with them all the time? Who is it? Is it their aunt, their grandmother, their boss, their boyfriend? Many times, traffickers will insist that their victims, especially for sex trafficking, call them daddy, or call them, Poppy, or one of those kinds of names. So are they being referred to as that? Again, all of these, when taken into, and when you keep in mind how well you know this person and how often you interact with this person, is going to be able to help you identify if that person is in fact being trafficked. We also talk context, because as I mentioned, these at first sight are not necessarily human trafficking victims, but they could be. We need to delve a little bit deeper. Because many times traffickers know not to, just like domestic violence abusers and sexual violence abusers, they know not to leave us mark. They're gonna beat their victims, they're going to violate them, but they're not gonna leave visible marks on their necks and their bodies. Most of the marks are gonna be under their clothing, so nobody can see. So you have to delve a little bit deeper when thinking about how to identify somebody. And as I mentioned, it doesn't always mean trafficking. So when somebody shows up to your counter and they were badly injured, you start to ask questions. How did you get that injury? Were you able to take care of it at the time that you were injured? Do you have safety equipment that you could wear next time? Or if somebody comes up and is constantly needing the morning after pill, or it's getting STIs, Can you ask them, do you need me to give you some condoms, or do you need to get some condoms so that maybe this can get prevented in the future? And if they seem hesitant or like, no, I don't need them, don't worry about it, or, those are ways to slowly start to ask these questions little by little to get a little bit more information about their situation. Okay, so now we're going to go into why is it important for us as people, as citizens, and as pharmacists, you all as future pharmacists, to know this information? Well, there's multiple reasons, but there's going to be two main reasons I want to talk about today. The first one is, as the professor mentioned, Houston, city in Texas, is the #1 place for traffickers. If you look at this infographic about Texas, you see how prevalent it is here in Texas. 79,000 minors are victims of sex trafficking in Texas alone. And we have 234,000 workers of labor trafficking. Now, human trafficking, if you look there at the $600 million and $6.6 billion, as I mentioned, human trafficking is an extremely profitable business. It is the #2 illegal business in the world, and that's right under drugs and ammo. And why is that? Why is human trafficking so profitable? Well, when you traffic drugs and you traffic ammunition and guns, that's a one-time deal. You pay somebody for the drugs or pay somebody for the guns or ammo, and that's it. It ends there. But when it comes to trafficking, you can traffic the same human being over and over again. So that's why it is such a profitable. And Texas is the second highest state with human trafficking calls to the National Human Trafficking Hotline, the second highest state. And the ports in Texas is what a lot of traffickers will use to transport their victims. But not only that, if you think about Texas and you know the geography of Texas, you have that one highway, the Interstate 10, that runs almost the entire length of Texas from the border all across down central Texas. And many traffickers know that that highway is very empty and isolated. There's only, and because it is such a large highway, it can't be patrolled as often as it needs to. And so traffickers are going to use that to smuggle their victims across the state and from border to border. So with all that said, there's a good chance that as healthcare professionals, as future pharmacists, you may come across a victim. In fact, there was a study that was recently done in 2020 that shows that almost 90% of victims will have some kind of contact with their healthcare providers while being trafficked. Now, that could be going to the pharmacy to get over-the-counter medicine. That could be going to the emergency room or going to a doctor. And many times when they go to their healthcare providers, it's often going to be way after the fact, way after they've been beaten. So it's not going to be, oh, I got an infection, let me go today, go tomorrow. This could be, they could have had these bruises, this infection for weeks before they go get it treated. So again, with that statistic being that high, there's a very, very good chance that some of you may come in contact with a victim of human trafficking during your career. So those are going to be, again, there's so many different reasons, but those are two of the biggest reasons why it's so important for us to know about human trafficking and what we can do. So now we're going to go over a few scenarios, and I'll read out the scenarios. And I'm not sure if this is the environment is conducive to get feedback from you all. If it is, wonderful. If not, I can just talk it through. So the first scenario, a young lady comes to your counter. She looks very young, but states she is 18. She asks for the morning after pill and what she could take over the counter for a UTI. You begin to ask her basic information, but she is very hesitant to answer. You also notice a slight bruise on her neck and hands. Now, at first glance, does this appear to be a victim of human trafficking? Probably not. It could be somebody who needs a morning after pill and does have a UTI. But there are definitely some red flags here. That could indicate something. We don't know. So that's when you ask a few more questions. You could say something as far as, oh, are you okay? I noticed you have some bruises on your hands and neck. Is there anything I can do to give you that medication, to help take care of it? Or how long have you had that? Do you need some more medicine for it? Things like that. We'll talk a little bit more about how to go about asking questions that are more trauma informed and survivor centered versus going right out and saying, what happened to you? So this is where you have to be creative and how you ask these questions. So scenario 2. A dental man in his late 50s comes up to your counter asking for pain medication for a sore back. You ask him how he got injured and he says he works in construction. You tell him about some over-the-counter medications he could use, but he says his funds are limited and can't afford much. You ask him if he has family or friends that can help, and he says no. He then tells you that he has to get back to work before he gets in trouble. Okay, so is he a victim of human trafficking? We don't know. We don't know, but there's a few red flags. So what are some of those red flags? Many times those who are in like this construction working and they are on a time constraint, their boss or trafficker will make sure they are on the clock 24/7, or they're only given like a 20-minute break. In an 8-hour day, they're only given one 20-minute break. And if they get back beyond that 20 minutes, they could be in some serious trouble. These don't necessarily indicate that it's human trafficking, but they should spark something in you to say, let me see if I can get a little bit more information. And then another possible red sign could be funds, that he has low money, he has low funds. It's not always, absolutely not. And he has no family and friends to help him. But again, potential red flags to ask more questions. Okay, go over one more scenario here. An elderly lady and a 14-year-old child come up to the counter. As they are approaching the counter, you notice the clothing of the child is dirty and torn, and she looks like she is malnourished. The elderly lady lets you know that she is there to pick up birth control pills for her niece. You give her a knowing look, and she quickly goes on to explain that her niece has bad cramps and the pills help. As she explains, she puts her arm around her niece, and the young girl tenses up right away. You try to make conversation with the young girl by stating that it is normal to have cramps. The young girl doesn't say anything and doesn't look up. They finish and walk away. So again, is this human trafficking? And if it is, what kind of trafficking would this potentially be? So yeah, so signs here are she's malnourished. Maybe also the state of her clothing, it's dirty and torn up. Whereas I'm guessing maybe the elderly lady, her aunt has nicer clothing on. She's malnourished. The birth control pills for a 14-year-old. Now, again, as you mentioned, it's not necessarily a sign, because I do know that, yeah, some birth control pills can help alleviate cramping pains, but it's a potential. And then that she tenses when her aunt put her arm around her, and that she's not talking. These are all signs. So again, come up with a creative way to get the young lady alone. You definitely have to keep your safety in mind, not just your safety, but other safeties that are around you in mind. So you cannot force it upon them. You can try to use your profession, say, no, this is something, she needs to be on her own to do this. We can't have anybody in there with her actually doing this exam. But in the end, if the lady refuses to allow her to go by herself, or just says, well, then we'll just go somewhere else, there's not much you can do. Now, when it comes to the fact that it's a minor, and you know that it is a minor, and we'll talk about it in just a little bit, there are ways that you can go to report it. Now, it's not necessary that you're going to report it right then and there and call the cops, because of course that's going to be a dangerous situation and you don't want that, but you are able to report it in a different way. Okay, so as I said, 3 different scenarios of potential of things that might potentially happen in your profession as a pharmacist. So what do you do if that situation does arise? How can you go about helping? You have to definitely keep in mind that you have to do a trauma-informed approach, survivor-centered. You don't want to make the victims or survivors feel that you're judging them. So the questions that you ask them when you're taking those next steps need to be neutral and non-judgmental. So it's not asking what happened to you or who did this. You have to, like I said, be creative in your wording. I noticed you have some bruising. Are you worried that this could happen again? Or, I noticed you have this, it seems like this infection's been there for a long time. How can I help you so that you can prevent it from happening again, or help you faster in the past? Just any kind of questionings that you use that will have the survivors feeling that they can trust you, because you're not blaming them. They won't feel like you're blaming them. What happened to you? Why did you have so much to drink? Those kinds of victim type blaming questions will break that trust real fast. And speaking of trust, you want to build that trust. But how do you build trust within a short span of time? Because again, you're only seeing them for a very short amount of time. So definitely when that person is accompanied by another person, in the case of the minor with her aunt, you don't want to ask questions in front of the other person that could potentially alert their possible trafficker that you're onto them. That's why you want to be as creative as possible to get that person alone, but not to push it, because your safety is definitely really important as well. But you can definitely have things in your area, in your window if possible, that shows that you can help them, that they are safe there. So some places have had just a small little flyer on their window or behind them or somewhere within eyeshot of the National Human Trafficking Hotline flyers. And so they may not be able to ask them, hey, do you need help? I can give you a phone number. What they do is they will every so often take, try to flag down the patient, that the potential survivor and victim, and have them notice that flyer. Or if they if you are able to get that person alone, you might not be able to give them a flyer with the phone number, because where are they going to put it? What happens if their trafficker gets a hold of their phone number and sees that they're trying to reach out for help? So what you could do is you can try with that time that you have them alone, get them to memorize the phone number. Do it in small increments. First memorize the first part, 1-800 or 1-888 or whatever it may be. And then memorize the second part and tell them that's the whole phone number you call when you need to get help, or when you can get help. Because it's not a matter of needing to get help. It's a matter of when are they going to have the opportunity to make a phone call? When are they going to have the opportunity to try to get away? The trafficker probably has them isolated and locked up somewhere. And then always, use language, if the persons are alone and you attempt and you have indication that they are being trafficked, then use, while you're talking with them, that little short period of time, let them know this is a safe area for you. If you ever need help, give us a call or come back. We can give you the medical care you need anytime, emphasize anytime you need. Come back if you need more medication, whatever it may be, so that they feel like they can come back to the window, to your pharmacist, to your pharmacy, and hopefully reach out to you again and again. So a lot of it's going to be, especially if there was somebody, you've got to be creative. But you definitely, most importantly, you have to take your cues from the patient. You, as as an individual, as a person, if you suspect that they're being abused and neglected and trafficked, yeah, you may say, oh, let's get you help today. You have to get away. We have to rescue you. But is that necessarily in the best interest of the victim at that moment? Do they need or even want that immediate help? A big thing with traffickers is they're able to emotionally manipulate their victims so much that their victims truly are bonded to them. There's no way they're going to leave this person. This person provides them the world. This person gives them all the money they want. This person gives them a home and a bed to sleep in. So you may think they want that, but they could have been so, you can use the word Stockholm syndrome. They could be so manipulated into believing that what is happening is okay. And then definitely keep in mind, is that person alone? Because if they're not, then you have to definitely, as we talked about before, think about the safety of yourself, the safety of others around. And then is a person a minor? Because if it is a minor, we are all mandated reporters to report human trafficking, child abuse, child sexual abuse, and neglect. So with keeping all that in mind, as we talked about, you want to provide them with phone numbers to get help. If you're able to, give them a phone number that maybe they can memorize. Let's just say it's in Corpus Christi, and the phone number to the National Human Trafficking Hotline is too long. You can give them the hotline number to the Purple Door. It's a very short one, 881-8888. Have them memorize that, and maybe they can use that when they need it. I talked about telling them to come back to your counter if they need help whenever they want, again with medications, and hoping that they'll see that you want them to come back, that you need them to come back, and that they are able to come back because it's a safe area for them. If you're able to slip them a small piece of paper with a list of referrals, some places have small little business cards that it's a size of business cards, and on there is a list of different referrals for them. Or some places have chapstick, and if you unroll the chapstick, on the inside of the chapstick wrapper is some phone numbers and list of places to go. And as I mentioned, all of us are mandated reporters for child abuse, child trafficking, and neglect. There is a way to report it anonymously online for child trafficking. If you go to the CPS website, there is a tab on the top that says report child abuse. And you can go onto that site and report it anonymously. Because if it is an adult, unfortunately, we are not able to report it if the adult does not want to report it. We can try to give them as much help as possible, let them know they're not alone, that they're safe, but we are not able to report it because it is an adult. If it is a minor, it is a completely different story. We have to report it. So real quick, I know we're running out of time. So here are the two numbers to the National Human Trafficking Hotline. And if they want to text, they can text the word "be free" to that phone number, and they can do it through text messaging. And that is the phone number to the Purple Door, and we can get them in touch with whoever they may need to be and get in touch with as well. So that is all I have.